Yeah. So, dear colleagues, activists, like we have dear activists with us, partners with us, and everyone, a very good afternoon to you all. So, thanks for registering for the webinar and joining us today in the webinar, despite all your hectic schedule. We are glad to have you here together today. So you all know that today we are going to know about a specific issue, but before going to our main presentation, we would like to hear from Kriya. We would like to know about FON Project, and then we also would like to hear about our financial supporters. So let us start, and then let's see who else we have, and we can eventually share everyone. Just for the administrative issues, I'm sharing with you all that for the webinar, we cannot open the camera. We can chat and introduce ourselves in the chat box. So if anyone want to talk or discuss something, let me know. I'll share Anu so that we have the access so that everyone can share talk. So to start with today's webinar, I would like to request our colleague Sudipta Mukhopadhyay to share her welcome note on behalf of Priya. So over to you, Sudipta.
Thanks, Bani. Welcome, everybody. A very, very warm welcome to everybody today, this afternoon. আর বিশেষ করে যারা বাংলাদেশের আমাদের সাথীরা খুব ভালো লাগছে আপনারা আজকে এই ওয়েবিনারে জয়েন করেছেন। A bit about Kriya very briefly, because I don't want to take much time away from the actual sharing about the findings from the report. Kriya, as some of you might know, is a feminist human rights organization based in the Global South, and we work on rights-based approach to sexuality and gender equality. We promote sexual rights for all and building leadership capacities, working with allies, activists, and movements is how we have been approaching our work. GBB remains one of our core areas of thematic work, and where we look at it through an intersectional lens, working with movement building efforts led by women and girls, persons with disabilities, non-binary, gender non-conforming, trans and intersex people. And many of you might know and have had the opportunity to know a little bit or more about Kriya, have been working closely with Kriya. Particularly for Bangladesh, I would like to share that Kriya has worked with many partners, and we are extremely fortunate to be allies of many partners in Bangladesh, many of you who are present here. And we believe that through FON, we've had the opportunity and the pleasure to extend this partnership, Kriya's footprint in Bangladesh. So warm welcome again, and happy to be part of the FON family, and actually getting to know, this is the first of the webinar that I'm attending, and I'm hoping to attend the others also. But looking forward to knowing more about the report on Bangladesh from the FON team here. Thank you.
Thank you so much, Sudipta, for your very brief welcome note. Yeah, thank you. So now let's learn about Feminist Opportunities Now project. So I think those who joined today, we all know about the name by this time. We know Kriya for a long time. We know about FON Project, but let's learn a bit detail on FON Project. So I would like to request our colleague Gayatri Gamagi to share about FON. We are really keen to learn about FON a bit more. So it's your turn, Gayatri. Handing over to you.
Thank you, Bunny. So yeah, I'm going to continue from where Sudipta stopped. So yes, we FON Feminist Opportunities Now project started working in Sri Lanka and Bangladesh, focused initiatives from the year 2022. And so this particular study is also coming from a contextual study that we carried out in the 10 FON countries. So FON is a consortium-based initiative, and FON works in 10 countries. And in Asia, Korea is leading the initiative, and we work in Sri Lanka and Bangladesh. So we operate basically with the overview of strengthening feminist structures to address gender-based violence. And as you may have come across, we have a grant partnership initiative with feminist civil society organizations. We work with registered and unregistered organizations. And in addition to that, we also have dialogues, learning exchanges, and also we have capacity sharing initiatives in terms of trainings with the feminist CSOs. And also we facilitate feminist organizations to participate in international and regional advocacy forums. So these are some of the very specific initiatives that we carry out. And of course, FON is supported through French Development Agency. Financial support is through French Development Agency. And to give a little bit of a background to the study that you are going to listen today, Antonia and the team carried out this comprehensive study in the 10 FON countries. So that was basically to see what is the context is about, how is the feminist movement operating in the countries. I'm sure Antonia is going to tell you more about it, but to position this particular study in the overall initiative, the purpose was to inquire what are the updates, what is the progress, what are the challenges our organizations deal with, and what are the laws and policies with regard to this context. So yeah, this is our contextualized study that we are bringing to you today. And we look forward to it. Over to you, Barney. And Barney, just one more logistic reminder that you can listen to this webinar through English or Bangla if you click the globe mark in the taskbar below, and you can select the language that you want to listen. Yeah, over to you, Barney.
Yeah, thank you. So yeah, Gayatri, thanks for your brief introduction. I'm sure we can learn more from you in the coming days since we'll be connected afterwards. So yeah, for everyone, again, those who want to hear in Bangla, please go to the globe sign, interpretations, and then go to the Bangla channel if you want to hear in Bangla. And if you want to continue in English, please go to the English channel. Stay in one channel so that you can hear with your preferred language. Yeah. So we have already heard from Sudipta about CREAS engagement, and we learned a brief on FON. Now it's time to hear from our financial supporters. We supposed to have Tamanna binte Rahman from AFD, the French development agency, but for her important work, she cannot join us at this point, but she said as soon as she can, she will join with us. So yeah. So since Tamanna is not with us at this point, we can go to our main issues of today's webinar. We can go to the presentation. So yeah, I would request all our partners, colleagues in Bangladesh to, if you want to hear in Bangla, go to the Bangla channel so that we don't miss anything from the presentation. And those who want to hear in English, please go to the English channel. So saying that, I would request Antonia, Maria, and our Bangladeshi expert, Tania Hawk, if she's with us. So this floor is yours and you can share the presentation. Yeah, thank you. Over to you, Antonia.
Okay, hi, sorry, I didn't find my microphone. Well, hi everybody. Thank you very much for the introduction. Unfortunately, I'm alone because my colleague Tanya, she was yeah, finally she will join later. She was yeah, she had a last minute constraint, and the idea was for me to do the presentation of the global research, and then her to support in the discussion. Well, maybe I will start the presentation, and like that I can introduce myself and my colleague and my team. Yeah, I think like that is. Can you hear? Can you see the presentation? Yeah. Okay, very well. Well, as my colleagues from Korea already introduced, this is the presentation today is in the framework of the findings of the research that was carried out in 10 countries, 2 countries in Asia, which are Sri Lanka, Bangladesh, of course, and Sri Lanka. 2 countries in South America, which are Colombia and Mexico, and then the rest in 6 countries in Africa, which are 4 of them in Western Africa, Ivory Coast, Ethiopia, Guinea, Burkina Faso and Niger, and then 2 countries in East Africa, that was Kenya and Ethiopia. Actually, I think that our colleague from Ethiopia is with us today. So hi, Asep. Because the presentation will consist. I will introduce a little bit the methodology and the objectives of the research, and then I will give you some insights on the methodology, and then we will present the general findings, and at the end we will focus on the country findings in Bangladesh and the final conclusions. So the research is very vast, we can say, because it's like a 300 pages report. So this is gonna give you an idea about the the structure, and then there are a first part of the general findings, and then a report per country. The information, the focus was to understand how feminist civil society organizations that work on GBV, on gender-based violence, how these organizations, what are the capacities of these organizations, and in what ambience, in what environment you are working. So it was a part of a contextual analysis that we are not going to present here today because you already know about your context. And so we will focus more on the analysis of the capacities of civil society organizations working on gender-based violence. And the research was very vast. We spent around, I think that around 6 months to develop this research in the 10 countries. We started with an inception phase for to develop and to plan the methodology and the research itself. After we started data collection, and we did data collection from September to November, and then we started with the data analysis, quantitative and qualitative data analysis. I will explain a little bit more about these differences and what kind of data we analyzed. Please, if there is something that you don't understand, or where just you can write in this chat, as I cannot read the chat while I'm presenting, maybe Bunny, you can just stop me and say to me if something is not clear or something like that.
Yeah, Antonia, can you do it full screen, please, so that everyone can see it?
You cannot
The-
see. Actually, I think it is. No, I will stop and restart.
Just go to the presentation mode. Yeah, just
Yeah.
go to the
Okay.
presentation mode so that everyone can see it.
Okay. I will. Normally, I thought that it was in full screen. I will try again. Now.
Can you please click on the presentation slide presentation, like at the bottom? Yeah,
Yeah. I did that,
yeah.
but I don't know
Do that.
why.
Yeah,
Okay. Now then.
let's wait. Yeah,
Because
still it looks the same.
yeah,
Yeah,
I don't know why. Because actually, I see the full screen, but you cannot see it.
okay.
Okay. Well,
And
maybe.
then you can, zoom in a bit so that everyone can look at
Yeah.
it, please.
Exactly.
Yeah, thank you. And Antonia, it's good to go a bit slow so that interpreters can follow you. Yeah, thank you.
Okay. Yeah. Sorry. I always have this problem. And with my accent, maybe it's not the best for you because we have a very different accent speaking English. Well, I will try again. Maybe I will. Sorry for this, huh? I will.
Please reshare. Yeah.
Okay. Right. Um. and- well, I don't know why this is happening. Anyway, I cannot do it better. And maybe now. Can you see it now? Completely? Okay. Okay, great. Sorry for
Yeah,
that.
now we can see the full screen. Yeah, please go ahead.
Okay, great. So as I was saying, the research was planned in 3 phases. Okay, inception phase, data collection, and data analysis, and we did the whole process in 10 countries. And how we organize ourselves, we were a team of 13 people, women, with the exception of 2 colleagues that were men. So the coordination is it was managed by Maria, Juan Carlos, and me. Okay, we are based in Morocco, and which is not a country target by the research. Okay, so we were this allow for a external analysis of the information, and in each country we had an expert, a national expert. So there were 10 national experts. In Bangladesh, we had Tanya Haq, that was the main researcher. And at the beginning, we started as well with Samara Mortada, that you might know. She was also contributing to this research at the beginning. And then we had two of them. It was a research with some, of course, limitations because of the diverse context, because the contexts are very different. So we try to have a standardized research, but as contexts were very different, it was not always obvious. So this was a little bit challenging to collect some of the data, mainly on intersectional discrimination and with LGBTI populations, because in some countries, it's not the case of Bangladesh, but in some countries this is a very sensitive issue. And even it was a little bit dangerous for the organizations and even for the project to show that we were interested at this kind of uh, subjects. Okay, and sometimes it was the case with migration, sex work, but mainly this concern LGBTI groups and diverse gender individuals. um, and then we had to change some methodology. In some countries, we had to change the methodology, okay, to not ask about these questions directly, to avoid risks. And the other challenge, of course, is the lack of standardized data in every country with the same information, the same way to collect information, to analyze secondary sources, and to mainly to compare the prevalence of GVV. It is not possible to compare it because every country develop data in a different way, so it's very difficult to be able to say this is the country where the prevalence of GVV is higher than in the other one. In some, yeah, we could do that for some kinds of violence, but not for all of them. Okay, so these are the main limitations. And regarding specifically the methodology and how it was in Bangladesh, I'm happy to see that there are many organizations here. And happily, I will say that a limitation in Bangladesh was the capacity to have many answers and responses to our online survey. But I'm happy that you are, yeah, that you are here. Uh, in general, we develop the main how we did collect information. It was with well, of course, the analysis of secondary source of information, desk review, but from primary sources, we develop semi-structured interviews with civil society organizations, focal groups, and online survey. In total, we developed 123 interviews, and then in Bangladesh, they were 10, with targeting seven civil society organizations. The focus group, we could not develop the focus group because we had some constraints in the country to adapt the period of field work with the period that we needed to submit the reports. So finally, it was not possible to organize the focus group. And for the online survey, I'm sure that many of you received the invitation to participate in the research because the invitation was sent by Gayatri, by Korea. And then we invited 57 organizations to participate because there were the organizations that we identified at the beginning. It's like we did a list of organizations that were working on GBV, feminist organizations, and then we sent email, but only 22 started the questionnaire, and finally 19 uh, passed the eliminatory questions that will explain to you. I will explain to you, and then finally we only could have 18 surveys completely filled in Bangladesh. We think that this difference, where in Bangladesh there is not a big difference between the organizations that started the questionnaire and the ones that finished it. So this is good. In some countries we have a very a more important difference, and we think that this is because the questionnaire, it was a very comprehensive questionnaire. So it was difficult to fill all the questions, and you needed around half an hour or 45 minutes to complete it. So this is not always easy because we know that we are very, CSO, you are working hard and you don't have time to many times to participate in this kind of researches. I will focus a little bit on the eliminatory questions. As I said, we were targeting civil society organizations that were feminist, which means that the main objective of the organization is to promote equality between men and women, and then that are working on GBV. So these were the three elements. So this is true that even if there are many feminist organizations, but if you are not working in GVV because you are working in economic empowerment or other areas, then yeah, the questionnaire expelled you. Actually, if you, according to this was important to compare the situation in the 10 countries. Okay, the big findings regarding the countries. We ask about the targets. Are we working with women, girls, children, people on a migratory situation, in displacement, refugees in the case of we see that in general, around the 10 countries, the primary focus, I mean, 91%, 84%. And then we have children, 62 of you working as well, specifically with children. This is something that is very important in countries, in African countries mostly, I will say, where we have very high rates of child marriage, which is also in Bangladesh, how, but not in the same prevalence. And those working on female genital mutilation. Okay, and this is more concerning African countries. And then specifically for LGBTI, we had 32 of the organizations, and migrants, refugees, IDPs, it was 33. Regarding the kind of violence, organizations in general, the total of organizations answering to the survey was 310. Okay, I forgot to mention that. So among the 310 organizations that answered the survey in the 10 countries, we had a working. It's very, most of you are working in several areas, but mostly on sexual, physical, psychological, and sexual and reproductive, sexual, physical, and psychological violence, and then in sexual and reproductive rights. Okay, these are the main areas of intervention, as well economic violence. And after, as I said to you, there are some countries where some kinds of violence are very, very present in civil society organizations activities, but it depends as well on the local context and how each kind of violence is very prevalent in this country, or if it's not very of organizations to work on that, because maybe it's prevalent, but it's difficult to approach, or the general context don't allow you for a work on that. As we were speaking, about LGBTI people in some countries where the activity of civil society organizations is very, very, very restricted by authorities. So it's very risky to work on that. Regarding the kind of activities, the kind of services that you are providing to populations and women and girls mainly, most of you are working in prevention, okay, and raising awareness. I'm sorry, because I see that there is a mistake in the presentation in the text. So most of you are working in prevention and raising awareness, and capacity building, okay, as a way to prevent GBV and to identify GBV. Unless you are working on the integrated case management. This is also, as we did the interviews and the focus group, we realized that this is as well because it's much more expensive, and you need more resources to work on case management. And then this might be more difficult, but as well is a choice of impact and effect. That the important is to prevent and to reinforce capacities to know how to deal with this problem. It's worthy to mention as well the advocacy targeting institutions that is developed by 62% of organizations. Regarding budget, this is the big challenge. We realize that from one kind of organization to other, but in general, all of you are struggling with the funding. because funding for GVV and protection and women rights is not always the first priority of institutions, firstly, and after of international actors or main donors. Okay, but here we have a good news. Actually, at least among the organizations for Bangladesh, I wanted to say a good news for Bangladesh. At least among the organizations that participated in the questionnaire, because Bangladesh is among the 3 countries where where civil society organizations had a higher budget. It was, for example, in Bangladesh, if you see the graphics, most than the half of organizations participating in the survey from the 18, you have 50,000 euro per year. Okay, this is something that is happening as well in Kenya and Ethiopia. And our explanation for it is that these are the countries in our research in which we have most humanitarian settings. I mean, where we have humanitarian crises that are being supported, and then this is mobilizing more resources. And then that's why you can access to this kind of resources. It's true that in Bangladesh, the organizations that participated in the questionnaire, as well among the bigger of the research, the ones with a higher number of employees and more capacities, structural capacities. So, of course, this is not just we think that this is not a representation of the whole country and all the feminist organizations. Maybe this is as well because the questionnaire was in English. This is a limitation that I forgot to mention before. The questionnaire was in English, and then maybe this was limiting the access to many of you to it. And we imagine the smaller organizations. Regarding the evaluation that you do on your capacities, in general, feminist organizations, you consider that you have structural problems that limit your impact and your capacity of action. And these problems regard accessibility of funding, diversification of funding, turnover, capacity of having very trained human resources, stability of the human resources. So this kind of capacity to develop strategies, to structure the intervention, to have long time strategies and projects. And then in general, in all countries, everybody, I mean, from 1 to 5, because the score was from 1 to 5, no one of you arrived to 3, thinking that your capacity is more than more 3, and just in a few countries is more than the half, that more than 2.5. And then Bangladesh, the analysis of your capacities in general is 2.47. So it's like in the middle. The evaluation, the auto evaluation that you do, the self evaluation that you do on your capacities as NGOs and CSO. Sorry, there is another mistake is here. I forgot to translate the title. I didn't realize. I'm just seeing it now. So regarding the environment, because during interviews, mainly during interviews and as well in the survey, we were asking about your environment of work. How do you feel in your environment of work? About your security, the support of um, authorities. How do you feel that the legislation is encouraging your work or not? So in general, all of you evaluate in the 10 countries, you evaluate that the environment for your activities is very challenging, okay? Because you feel that you are at risk, that you are working in a sensitive area, and this is something generalized in all countries. In general, you are very concerned about your security and integrity risks, and you are unsatisfied with the mechanism that exists in the country to ensure your protection against threats and attacks. And mainly, this is very related to cybersecurity and the cyber harassment and this kind of or the obstruction of your activities, sometimes of barriers that you are facing when you are on the field, but mainly now when you are trying to do advocacy, and that there are is the level of attacks and threats mainly online against feminist activists is increasing, and then you feel that you are not protected uh, uh, on that. Um, in general, you think that the level of implementation of the legal measure to fight GBV should be uh, improve as well, should improve the level of implementation of the legislation, even if the legislation have gaps. But the problem as well is the laws are not implemented, and this is something that generally affect your environment of work, and that you pointed out during the research. And you are not, and you feel that the national institutions are not really supporting this area of work. Some of the barriers come from the communities, and mainly you were identifying some community leaders as opponents to intersectional feminism and the work that you are developing as feminist and working on GBV. And in general, they were described, the opponents, community opponents, they were described normally, they were men. Of course, we can find women, but as we are speaking about the leaders, normally the leader are men, older men that might have yeah might have positions against the values that you defend. In the case of some specificity in the case of even Sri Lanka and Bangladesh, that you were mentioning political parties and political leaders. And this is something that, of course, appear in other countries. But for example, in Africa, they were referring much more to political community leaders and not political parties. But it will seem that in your countries, this is something that is included as well in the political programs and the political visions or of some leaders. This fight against feminism values. This is the general conclusions for all countries, and now I would like to do a focus on Bangladesh. Regarding the areas of intervention, in the case of Bangladesh, all of the organizations that participated in the research were working on sexual and reproductive rights violations. Okay, so this is a main area for you. And then child marriage, it was as well a very important issue for you. Sexual violence, physical violence, psychological violence, and economic violence. This kind of problematic. So this is that are your main areas of intervention. Regarding the services and activities that you are working on specifically, all of you work on awareness of around raising awareness for populations on GBV, on the capacity building to prevent GBV, and on capacity building on advocacy against GBV. So this 100% of the participants, you are working on that. And then the second area of the fourth, let's say, area of intervention is capacity building on sexual and reproductive rights. So here we are reproducing the same trend. We can say that generally around the 10 countries, that main areas of intervention regard capacity building, advocacy, and prevention. And for example, if we go to the case management, you will see that it's just integrated case management. It is 63% of you. But for example, when we go to accommodation of GBV survivors, that is the big challenge in many cases, how to protect the woman, how to have a safe space for her. Yeah, in Bangladesh, even if you are among the higher organizations and the ones working with a higher budget, just 11% of you have this capacity. Mhm. Regarding the level of intervention among the participants, the 18 organizations participating in the survey, 37 had a national outreach, and the rest, 47, you were working in at local level. Many of you are working with girls and women as well, and children. And then regarding your assistant capacities, more than the half. That's why I was saying that you are among the countries with organizations having higher capacities, because more than the half of you have the capacity to work with more than 200 beneficiaries per year. Okay. And you are among the countries where you are working more on intersectional areas as LGBTI people and sex worker, because 32 and 36 of you were working on that. This is not the case in all countries where these subjects are not considered a lot. Regarding the funding, as I said at the beginning, more than the half you are working with more than 50,000 euro per year, and main of your fundings are coming from international cooperation. 79 of you are your main source of funding is international cooperation, but an important percentage, 37%, you are founding with your own resources as well. Okay. During the research, we were interested in knowing how the instability during last 5 years, and mainly regarding COVID, but as well or the other kind of instability, because COVID was affecting to the whole countries, but we also have some specific crises. Like in your country, there is the, sorry, because I don't know how to pronounce the Rohingya crisis. Um, so this is specifically in the case of Bangladesh. So we were interested in knowing how this crisis affected the availability of funding, the number of people that you were assisted, and the coordination. We can see that the COVID and the Rohingya crisis reduced the availability of funding, uh, but increase the coordination among you, and as well increase in the case of the refugee crisis, increased your activities and the number of people that you were assisting. Regarding your communication capacities, this was as well a specific question. Among you, 84% you affirmed to have a communication strategy, and most of you are using Facebook and websites as a communication tool, as the main communication tools. And this is something that is also a general trend in 10 countries. Most tool that you are using are websites and Facebook. It's not Twitter, not TikTok, or other media or network, but Facebook is the first one. And as well in the self-evaluation about your capacities in regarding different topics, you identified fundraising and GBV case management and intersectional feminist approaches were as the areas where you will need more support to increase your capacities. And then the areas where your capacities and knowledge are more consolidated are GBV in general, the knowledge on GBV, the capacity to drive action and achieve positive change on women's rights, gender equality, and to fight GBV, gender mainstreaming, and project management. This is your main areas of where you feel that you are very strong. Because if you see the graphic, the punctuation is almost 5. From 1 to 2, it's almost 5. As general conclusion, well, just the highlights. We have the report include a lot of information that we are not presenting today to make it shorter and to let time for the discussion. But main ideas, Bangladesh is the third country where feminist CSO work with higher budget. Dependence of international humanitarian aid is high in your country. Bangladesh is among the countries in which civil society organization consider facing structural problems, but is in the middle, and 50% of you consider that you have this kind of problems. So the half of you consider that you have structural problems, even if regarding the rest of the countries you are in the middle. There are other countries that consider that they have much more difficulties. And then the main needs of for your reinforcement, as we said, is fundraising, GBV surveyor, case management, and intersectional feminist approaches. And so this is the presentation, and I'm happy to hear your questions and to discuss with you. And I'm sorry, I don't know if Tanya, my colleague, is already here, because I would like to very much her to introduce the work, but I think finally she cannot join us.
Hi, Antonia. Yeah, I think Tanya Hawk didn't join us so far. So yeah, we thank you so much for your very thorough presentation. This is such a great presentation, and I think compared to the detailed study and report, the presentation is brief, but very meaningful for us. Like, I was also following the comments, so I'm sure that our colleagues, our partners can connect what you were saying, and I'm sure they can add even more with it. So going forward, like for the question answer and discussion session, I'd like to request Sudipta to facilitate further. So Sudipta, I'm handing over to you.
Thanks, Bani. Antonia, thank you so much for an excellent presentation. And I'm sure those present today would really kind of concur with many of the things that you have shared with us today, regarding the realities of working and the challenges of working on GBV issues in Bangladesh. So going into the Q&A session, what we could do is we could have a show of hands. Is that possible, Bani, on the webinar, or we only go by chats?
Yeah, we can go by chats. It's easy, but if
Okay.
anyone really want to share any insights, we can also give them access to talk only.
So we are looking at the next 15 to 20 minutes of a Q&A in terms of questions or comments that you might have. So can you please take out time to share your question or comments on the chat? We have one for now, which Antonia can answer. And then we can take maybe 2 to 3 together. This one I will read out. So question is, how many of the CSOs who filled out the survey are unregistered and from rural backgrounds, that is not from big cities? Also, how many were from indigenous background?
Yeah, perfect. So I was looking for the information. Sorry, Can you hear me, right? Yeah. So from the organizations, according to the information that on the survey, so we have 79 of the organizations were registered. So we have 21 of them, 20% of them, 20% of them that were not yet registered. Okay. And according to the reason to not be registered, they mentioned that was because they are working on socially sensitive activities, politically or sensitive socially activities. Others are no, there are not relevant reasons. In many cases, this is something that happened in other countries. It's just because maybe they didn't complete the registration process, or they are just starting or something like that. So, but in the case of Bangladesh, 20%, 21% of them were not registered. And as I said during the presentation, there are a high number regarding other countries that was working just at local level, 47 of them. So I imagine, because the problem is that in the survey we were asking, are you working at the national, regional, or local level? And if you are not national, please tell us which is the region. In the case of Bangladesh, in most cases, this question was not completed, so we could not know the region of the organization. But many of them, because of the answers in the other areas, they are working on the Rohingya crisis. So this is if I'm not wrong, is the specific Kosar, I don't know how to pronounce the region, but this is specific region, and the others, the other we don't know the region, but it's 47. So this is an important percentage regarding other countries. Regarding if they are from indigenous backgrounds, we cannot know, but we think of, and this is a limitation of the research, that in many cases the survey was not accessible enough because it was in English. So it was not translated, and this is something that happened in many countries, that we just used we were working in Spanish, French, and English, and that's why as well the presentation sometimes we forgot to translate something. Sorry for that. So yeah, we could work in 3 languages but not more, but this is a strong limitation.
Thanks, Antonia. Moving on to some others, a couple of our also questions are related to the first one. How many grassroots organizations were included in the research? So in terms of the question, what you're saying, 47% were responded that they worked at the local level. So whether that you would say that they worked at the grassroots level. So because the question here is Dhaka based. Dhaka is the capital city of Bangladesh. So the question here is Dhaka based organizations often have funding. How about organizations from non-Dhaka based organizations? So whether the survey included that perspective, and as a respondent in terms of the ease of funding being headquartered in the capital and having access to funding.
Yeah.
The so I'll share the next one and maybe you can answer that together. Although recent work on GBV in Bangladesh has increased, it is more urban based and counseling is less prevalent, also still lagging behind in advocacy. My question, do you have any reports or police reports where women expect more help in times of emergency?
Well, regarding the first question, we could have the information, because we can see where is the place of implementation of where we need to, as I said to you, when they were saying the level of intervention, they were not saying where they are working. So we don't know if Dhaka, I mean, we don't know if we imagine, for example, that the organizations that said we are working at national level, they are based in Dhaka, then yeah, we can do this I mean, I can tell you if these are the ones with higher funding, but this is something that we cannot be sure because the organizations didn't mention, they didn't answer this question. With this, your city or your region or your location. But I will try to give you the information because I'm opening the survey with all the information. I will analyze that. And regarding the second question, well, I imagine that we don't know. We didn't approach women. So our target was, we were working, our research was targeting just the organizations, public institutions, and UN agencies. We were doing interviews with this kind of actors, so we didn't work with the population. So we cannot have information about the expectations of the needs, specific needs of women. We can imagine them, and we can, of course, there are secondary sources that we analyzed. Yeah, but we didn't not that change with women. This is something that is important to mention, I think.
Thanks, Antonia. Next couple of questions. Does feminist organizations mean women-led organization, or it could be any organization which believes in feminist rights? So that's
Yeah,
one question. And the other one is, I wanted to know that is there any CSO from Bangladesh was targeted or finally reached who worked to promote, protect the rights of Dalit women who are, so women from this community who are discriminated based on their caste and descent?
mm. Yeah, I will start by the last one. Yeah, we included in the survey, not just even the survey, but as well during interviews, we interviewed organizations that were working specifically with Dalit women, and this is something. Yeah, this is something because I didn't present the context, but this is something that in the case of Bangladesh, when we were speaking about intersectional discrimination, intersectional feminism, of course, in the case of Bangladesh, everybody was focusing on this woman, on Dalit woman, um, because of the caste discrimination. Yeah, well, you already know. So this is something that is specifically, and in the case of Bangladesh as well, when we analyzed the legislation, yeah, as religion is influencing a lot how legislation is influencing each group of women. So this is something as well that is analyzed and is quite interesting in the case of your country. Regarding the other question, what was I forgot, sorry.
Yeah, in terms of meaning of feminist organizations, that
Yeah.
were the question around that.
Yeah. Yeah, for us, the definition was organizations not led by women, but that they have gender equality as a main or significant objective. When I explained to you at the beginning that we had these eliminatory questions in the survey. So when the organization, we were asking to the organization, is gender equality a main objective or a very important objective of your organization? If they were saying yes, then for us it was a feminist organization. It's true that even many of them, or it's not always, but because we had another question saying, what is your level of agreement with this statement? And then the statement was, my organization is a feminist organization. So not all of the organization that have gender equality as a main objective consider themselves as feminist. But well, for us, in our definition of feminist, they were included. But it's true that this is not always the self perception or self definition of organizations. Mm.
Next question. Any difference in the annual budget between registered and unregistered organizations?
Yeah, this is something that I'm looking for. I will tell you in a while. I'm looking for the information.
Thanks. Next question. Sorry. We found during COVID the GBV against women unexpectedly increased. Do you have any database or report comparing with your survey time?
Yeah, actually, we don't have information on the, I mean, in the survey because for the context, how did we analyze the context? We focus mainly on secondary sources and in the interviews and focus groups. In the case of Bangladesh, interviews. Uh, yeah, this was highlighted in all countries that during COVID, GBV increased, and mainly everybody was speaking about cyber GBV, online harassment, online violence, and this is something a trend, a general trend in all countries. But we don't have. Well, I don't know if we included some of these. Maybe there are some statistics in the on the report, but I don't think so. But because in general, available, there are not a lot of data on that. There are not available um, formal or reliable data on how many people, how many women were victims of GBV, online GBV during COVID. So I don't think so that we could include statistics, but and we did not ask that in the survey, but this is something that in all countries was mentioned during the exchange with civil society organizations.
Thanks. The next is more of a comment related to what you've already mentioned earlier, that Dalit women undergo double marginality for their caste and as a Dalit woman in the society. Uh,
Yeah,
then, yeah.
and the question is a
Uh,
comment, right?
Comment, yeah.
Mm.
Um,
Yeah,
Next question, how many areas of Bangladesh has this survey been done? So,
it was a general survey because this is important to mention. We didn't want to target. I mean, we wanted to have like to know civil society organizations, right? Then to know them, we launch the general survey. So we did a list with the in collaboration with CRIA and the partners of the project in each country, our expert in each country because they knew the organization. So in the case of Bangladesh, we started with a list of 57 organizations, and then we sent the survey to everybody, and then the idea was that this to do like a snowball, right? Because one organization can send to the other and to the other. So we were targeting generally all organizations. We were not targeting specific areas or because we didn't have the information about the exact name of organizations. And in our objectives was to reach the smaller, yeah, mainly the smaller ones. But yeah, this is the limitation was the language, I'm sure. And well, finally, we had the 18 responses.
thanks, Antonia. Next couple of comments. In terms of a comment, the general conclusion says in Bangladesh, CSOs had annual budget around and over 50,000 euros, and it could put a challenge in accessing funding for the small organizations, such as the one FON is working with. So, the larger macro number could mask the reality of small organizations and access to resources. Second is in terms of you being very brave in kind of admitting the limitation of the study. This is related to the language limitation. There are indigenous feminist organizations who are fluent in English. I'm just wondering how intersectional approach and indigenous organizations context can be addressed, um, given that there's a language limitation.
Mm. I mean, if the language was not a limitation, I mean, I maybe the problem. I think that maybe they didn't have the information because it's something where this is something that happened in many countries, and it is good for the research and bad at the same time. in the sense that, for example, many of the organizations, most of the organizations that participated in the research in all countries, they didn't know the FON project. So maybe we imagine that this because I mean, we could reach many of them, right? And it was not just because we were connected to the project and they are connected to the project. So this is good. So we think that we have a good capacity of reaching organizations. After, in the case of Bangladesh, for example, from 57 that received the questionnaire, just 22 started to do it. And we did a big effort to call everybody, to ask them to complete, to fill the questionnaire. But I imagine that here the challenge was as well, not just language, but as well the availability, because mainly when you are small organizations, and this is something that we discussed the other day in the presentation in Colombia, they were saying, we don't have human resources, we don't have staff for this. So finally, for people that just women, in most of cases that are doing volunteer work, it's very difficult to have the time to be able to answer these kind of questions. Well, I don't know if it's the case of Bangladesh, the level of people that is working voluntary in the small organizations. I imagine yes, because in our organizations you are the bigger. Here in Bangladesh, the ones who answer the questionnaire are the bigger, mostly. Yeah.
We'll take two more questions at this stage and then maybe include some comments after this. Have you included third gender-based organization in this analytical mapping? That's one. And about online harassment and violence, did you cover this through the survey? And which CSO works to address online violence, or at least a percentage of CSOs from those who have replied who work on online GBV, addressing online GBV?
Sorry, can you repeat, please, because I cannot see the question and I
Okay, I'll repeat one by one. One is that
yeah.
have you included, does the study include third gender-based organization?
Sorry. Yeah, I didn't understand
So any organization who said that they work with third gender population,
we third, yeah. Sorry,
non-binary,
sorry. I didn't understand. Yeah. We also actually, yeah, in Bangladesh I think is the only country in the research that you recognize the third gender. And among the 10 countries, yeah, it was the only one. So we were very interested on that, and we included this kind of information, this kind of organizations. We did interviews, and as well we had some important reports on that we could use, because there were information, it was totally different to other countries where I said to you that it was very sensitive to work on that, and it was not possible to have information, and it was very risky. So yeah. Mm.
And the next question is on, did the survey cover the question on whether the CSO worked on online harassment or online violence issues? Was this covered in the survey question? And also, what percentage of CSOs reported that they addressed working on online GBV issues?
Yeah, we included this option. If you want, I can share it with you. For example, to know the specific information on Bangladesh, because we included specifically this question on if they were working in the options. Among the options, yeah, I will share again. Can you see it now? For example,
Yes.
here, if you see this slide, these are your area of work, and then we were including feminicide, economic violence, psychological violence, physical violence, and here we had specifically online or digital violence. And then in the case of Bangladesh, 58% of you were working on that, specifically on online or digital violence. Yeah.
Thank you, Antonia. For me to, so maybe we can take a short break here and reach out to Tamanna, Bani.
Yeah, sure. Sure. Hello, Tamanna. Thank you for
Hello.
joining us. Yeah.
Sorry. I'm actually very late. I supposed to come in the, at right time, but tomorrow we have a big event here. Like we have to sign a big project with Bangladesh government that is to support, the policy support in climate adaptation. That's why everyone is busy in the office, so I could not keep my word. Anyway, I am Tamanna Binte Rahman. I'm the project manager of AFD. I have been working for AFD for last 2 years, and welcome Shrita on board. So the first meeting with you, and what I can say that I'm the gender focal from. I based in Dhaka agency, so I'm the gender focal for the agency here, and that is my role to coordinate with you for this project. But I'm sorry that I could not. Could not able to see the total, the analytic and mapping things. So I'm not sure that what already happened or what Antonia shared here. But I think the people who are participant today in this event and the webinar, I think they're already get the benefits of this research, and I think it will be helpful for them in future as well. Thank you.
Thank you, Tamanna. We actually, the way we scheduled, we have shared with our participants, our colleagues, our partners, and activists. We shared everyone that the good work that we are doing. This is supported by AFD, and we also announced your name and said that you sent us an like email note that you cannot join us at this point, but later you will try. And thanks for joining us. Yeah,
You are
you made
welcome.
time. Yeah, yes, sure. Go
Just
ahead.
just to inform everyone that for the participant, I think you all know me, but for the participants actually, if you know that AFT is working here for last 10 years, in Bangladesh, so it's quite new if you compare to other development partners like ADB, JICA, or World Bank. So we are very new here, but it's like we are in full force right now. So we are now have a big office in Bangladesh, and we are working on climate change fighting and supporting Bangladesh government, and also like working in environment protection and other development, urban development side. So as I don't know, like how many of you know that actually AFD is one of the organization that declared themselves as a feminist organization. So we can proudly, say that AFD is one of the bank, development bank who is the feminist, who declared them as a feminist organization, and I feel very proud that because not many organizations are talking in, about feminism in like in public. So that is a good thing. And uh, based on this goal, like having all the projects targeting the gender equality, AFD actually having so many programs on gender equalities and support gender mainstreaming. And so one of these initiative from that support actually came, and that is FON, Feminist Opportunity Network. So I think now you will know about AFD more, and maybe in future we will discuss and have some dialogues about AFD and its work in Bangladesh. Thank you.
Sure. Thank you. Thank you so much, Tamanna, for joining us and share your words. Yeah. So Deepta, over to you again for the question answer and discussion session. So we have few other questions, and also our colleagues wanted to share a few words. So once we are done with the question answer session, then we will ask for their comments. They're raising hands. Yeah.
Okay, so maybe one comment, one or two last from here, from this that can take, and then those who want to share verbally, we could, give a chance. So one of the things, and this is Antonia, this is in Bangla, so I'll just translate. If I'm kind of done any error, someone can, Mani, you can let me know. So the GBV work in terms of prevention and response, overall the budget for work on GBV response and prevention is decreasing. Yeah. So this will have an impact on what kind of work and that organizations or CSOs are able to do because of this overall reduction in financial resources for GBV related work. Did the survey ask this question in terms of this context of reduction in resources, and therefore will it have an impact on the work?
No, I don't think so that we can know. I mean, the idea will be to know how the availability of funding regarding the different areas of action is affecting the area of action, no, of the organization. No, we cannot know that because we didn't analyze the kind of funds that are available or the priorities of donors.
The next question is more addressed to Kriya. So I'll just quickly, without taking time, the question is that there are many organizations here who are attending this today, who are working on GBV issues, combating early marriage, dowry, and working with and on issues of LGBTQI. How can Kriya cooperate to work all together on the issues to make a more meaningful movement to reduce GBV? Really appreciate this question. Kriya actually works through different. FON is one mechanism through which we work. There are other programs of Kriya through which we actually co-create and work with our allies, and that also includes of issues of GBV. So different ways. We of course have our limitations, our own limitations to the extent and the expanse that we can work, but we try and work to the extent possible. One of the things which we also kind of Kriya is very conscious of is also holding dialogues with organizations who might not be directly associated with Kriya, like for here within, they're all not FON partners. So similarly in other programs also, for example, our support from the Dutch Ministry of Foreign Affairs, where we've had the opportunity to sit together and with partners working on different Dutch funded programs to actually discuss and share among each other our strategies and our work. So these are some of the small ways in which Kriya tries to kind of work with everybody given all the limitations. Yeah. So I'll stop here, and maybe Bani, we could now take comments from those who have raised their hands.
Yeah, sure. So Nadira Parveen, you have raised your hands.
Maybe just a second, sorry, before going ahead, because I was looking for the information on the other questions that they still regarding the budget. So yeah, regarding there is not always a relation. It's not always the ones in DACA that are the more that are access to higher funding. Actually, we have many organizations. I cannot say to you now the percentage because I just looked the information, the answers, but there are many of the organizations that were mentioning that they were working in the local level or regional level, that they had more than 50,000 euro. So we think that this is related to the fact that they are responding to the refugees crisis. And then regarding the registered or unregistered, yeah, normally the ones who are not registered, the budget is much lower. Someone was asking, I think that we forgot about sex work. We have many information on the research about that. So when you will have access to the full report, you will have the information, because we put attention to this and the legislation in Bangladesh and how the organizations are dealing with that. That's all. Sorry.
So Sudipta, Nadira Parveen from Nagorik Uddog, she raised her hand to share something.
Yeah, thank you so much for the Kriya team for giving the opportunity for having the discussion and taking part in the discussion as well. So First of all, I, as a development activist, I was not aware about this survey, but I must admit, we know Kriya has doing the lots of work, activities, capacity building, and advocacy at even the UN level to promote the rights of women and vulnerable section of women. So, as I am working basically on the Dalit rights issue. So my issue is related to Dalit women issue. So we have partnership with CSO. We are national level human rights organization. Access to justice and their capacity building also part of us. And we want to see the CBOs who is led by the Dalit women, they should be the part of this process if there is a scope, that is. And my concern is, as the promoting equality of men and women, is it does Kriya think only women-led CSOs could be the part of the project or the advocacy and capacity building initiative that is being implemented by the Kriya? And I have another request to you. As we have long experience to work on the vulnerable section of people, and we are leading the campaign that is BDNM, Bangladesh Dalit and Socially Excluded Minority Rights Movement. So we are not looking for the partnership, but we can be the resource sharing partner for the information. If you really want to include the vulnerable section of people in your program area or research work. Thank you so much. And Monirani Das, she is one of the Dalit women and the old women, Dalit women-less CVOs. I think you can consider also her for interview or capacity building event, because we are heading towards the SDG in Bangladesh. No one leaving behind is the motto. And Dalit section of people are the most, because they live in the isolated area. Nobody, they are mostly untouched. And untouchability is the main discrimination for their caste and decent work. So please consider their issue. That was from my side. Thank you so much.
Just to add here, I don't know, Antonio, whether you want to comment on this or take this take this into account. But Nadirapa, thanks for sharing this. Well taken, your comments and your suggestions. The thing is, this study did include those organizations who reported they were working on issues of Dalits or with Dalits. There are also comments in the chat box which we recognize that there are many other structurally excluded communities, women from the tea garden community, from the tea plantation communities, who are structurally excluded. So yes, thanks for mentioning this. Regarding whether Kriya works with only women-led organizations, no, Kriya does not work only with women-led organizations. We work with organizations led by women, girls, non-binary persons, so trans rights organizations, sex workers organizations, so led organizations. So Kriya works with a range of feminist, diverse group of feminist organizations. And it has over the past years, it continues to do so and will do so in future.
Thank you so much for your response and for clarification. And you see Tamanna Singh Barai, she is also from the tea garden worker community and belong to Dalit community. There is a huge number of Dalit people who was bought by the British government in the tea garden area to work as a chief labor in the tea garden.
Thanks. Yes.
Yeah. And I will share on my organization website. You will see different kind of study report there. Sexual reproductive health rights of Dalit community, water sanitation, housing, rights situation. If you feel worthy to know
So
about.
please do share the link of your website here, or you could share email Bani and to us. We'll be happy to kind of know more. And just to be mindful of time and everybody who's here, Bani, over to you, and how much of time we have and how many more comments we can take. Maybe we can take a last comment. We have about 3 to 5 minutes now.
Yeah, we have 3 more minutes.
Yeah, so maybe one more person that we can accommodate.
So like we have no one else to speak. So yeah. And I think we already addressed all the comments and questions. So if there is anyone who wants to talk, share any insights, we can really accommodate. We have also shared the PowerPoint presentation from Antonia and also shared the summary report with participants so everyone can download it. And if required, they can also ask for the report to us. Like they can send the email to fon@creaworld.org, and also they can email Gayatri and me directly.
Just one question in terms of the overall plan for sharing of the global report, Antonio, if you could let us know about that.
Yeah, sincerely, I don't know because it's the other partner is doctor. How do you call them in English? Médecin du monde, doctor of the word. That is gonna actually the good. I think is almost ready. Should be almost ready because the report was written in English, so we don't have in your case we don't have to wait for translation. But this is better a question to Anna, Anna Verdu, because I don't know.
Okay.
I am just sharing that the report is ready and it can be shared with everyone. So yeah, we can maybe Bani send a mail. We have all of your email addresses. We can share the report, and also it will be made available in the website feministnow.org. If you go there, and also will be shared in social media. Thank you.
Maybe we need just to wait for. There was something that we realized last week that we have to change, but for the rest, so maybe just wait for this little adjustment, and it's ready.
Thank you, Antonio. Over to you, Bani.
Yeah, sure. So Tasafi, do you wanna share something?
No, I just had the question. Like, I think we're talking about how to share the report, but like my question was more, is there a specific intention of how we want to use this report? Like, is this intended for donors or other stakeholders? Like, just an understanding of that.
Yeah. So Gayatri, over to you. You can respond on that, right?
Yeah, I think in terms of the information we have shared, so in terms of the internal purpose of carrying out this study, it was for us to understand the situation, the updates, and also to understand the prevalence of GBV and the systems, structures in the same. So that we can cater into the requirements and the needs in each of the countries that we work on. So that is in terms of our own use of the report. So the reason we thought we would want to share this with everyone is because this is a contextual analysis of each country. So it could be in terms of the civil society organizations. You can use this report in terms of designing your interventions, can be used as a need assessment and overall national level need assessment, and also sort of like a policy assessment in a way also. And in terms of the donors, of course, too, I mean, yeah, different ways that this report can be used as in creating and designing the funding cycles, and in terms of understanding the context and then catering to the contextual needs. So I believe we all can decide how we want to use it. So that is exactly the reason we wanted to have this meeting, not to like contain the information within ourselves, but instead share.
Just to add to this is, the two things in terms of what the report shared. One is validating, that fundraising, the need for fundraising, and because of the lack of resources, on issues of GBV, particularly to certain types of organizations and their identity and their registration. Second, in terms of what's very interesting for CREA, is the capacity development need around intersectional feminist approaches. So therefore, in terms of FON, as you know, that it's not just about sending resources from point A to point B, from organization A to organization B, but resourcing is just one part, but also in terms of creating opportunities for capacity development, which is a significant part of FON. And therefore, knowing that there is one need in terms of intersectional, building a more stronger, enhanced, comprehensive understanding of intersectional feminist approaches in the context of GBV. So it will be, that's something very interesting for CREA, and we are thankful that the report brought this out, and we will be mindful of this. Yeah, thanks.
Hello, everyone. So that we are running out of time. Actually, we are out of time, but our colleagues, partners have more questions. And I think one of our colleagues also wanted to share something with the name of user. So respecting everyone's time, we would request to finish today, but definitely we can organize more events to learn and share our thoughts and to work together. So if with everyone's permission, I would like Sudipta to close the event, please. And sorry, those for whom we cannot respond back, but we'll try to respond back over email and through other learning sharing session. Thank you. So over to you, Sudipta.
Thanks to everybody for taking out time, 1.5 hours from your busy schedules. It's not easy. And we are very, very thankful to all of you for giving the attention to knowing about the report and what its findings are. And a big thank you to Antonia and team to bring out country reports and to reflect each and every nuance of the country's context in a report. And sharing this, and we hope that there will be many other opportunities within FON to have such discussions and continue this, because GBV remains a core theme of FON, so there will be other opportunities in future. Thank you again. Thanks.
Thank you very much.
Thank you very much. Thank you everyone for joining us. Yeah. Thank you, Tamanna, for staying with us.
And thank you to our translators, Arindam and Partho.
Yeah.
Anu, thanks for all the support.
Thank you, everyone.
Thank you. See you later. Bye.
Bye, Tamanna.